Andrea, the occupational therapy student from Boston University. In this video, we are going to learn about medication management. When I say medication management, I mean everything from getting the prescription in the first place, interpreting the complex information on the prescription label, taking the medicine, and refilling the medicine. The goal of this video is to give you information and resources about how to easily manage your medicine. Understanding and taking medications at the right time helps reduce your risk for falling. There's a lot that goes into how to manage your medicine. The main topics we'll cover today are understanding the what, why, and when of your medications, knowing when to report any side effects, and refilling medication. The National Council on Aging created a wonderful resource to help you manage your medications. Check your weekly bulletin or reach out to Lisa to get it. The form looks like this and can help you organize and have an updated list of all your medications. It can help to bring the form to doctor visits with you to show them a list of all the medicine you're taking. The doctors then can see if you have any changes and can help you reduce any side effects if the medicines are acting against each other. This form also is helpful since it has sections for why you're taking it, how much you're taking, when you're taking it, and the side effects that may happen. If technology is more your cup of tea, the app CareZone can help organize your medications, the purpose, the dose, and remind you when to take the medicine. Also, it can send you reminders on your phone about when to refill your medication. So now the what. What is important to know about your medication? Understand the purpose of the pill. Why are you taking it? What to do if you miss a dose. Does it have to be taken at a certain time of day? For example, maybe it makes you feel tired, so it should be taken at bedtime. What side effects should you be looking out for? Are there any interactions from one drug to the next that may, if you're taken together, may have a negative side effect? Most importantly, ask your doctor or pharmacist to clarify any questions you may have about your medications. If you are unsure what the pill is and what the purpose is, check in with your doctor or see if the local pharmacist could help you. If you like technology, Google Pillbox. It's a government website that helps you identify the pill by what it looks like. That way you may not have to know the name of it. Another website that might help is drugs.com. These both can be found on your resource sheet. So you can input the shape or the color and search for what the medication is. When you identify the pill, you can click to learn more about the medication. You can also ask your Alexa speaker by saying, "Alexa, what is Advil?" or whatever drug you're looking to know more about. Or, "Alexa, what are the side effects of Advil?" or whatever you're looking for. Ask staff, family, or friends to help you set up the skill on your smart speaker. Let's see Alexa in action. Alexa, what are the side effects of Advil?
Advil may upset your stomach or cause nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness.
Alexa is helpful, but for any serious medical concerns, ask your doctor. Also, you can find some information on the label of your prescription. Many of them can be confusing, so ask your doctor or pharmacist to clarify. We can go over some general information you can find on the pharmacy label. Pharmacy labels vary, but often most of them you can find when you're supposed to take it, how many refills are left, and until when, the doctor that prescribed it, the name and strength of the drug, and instructions on how to take it. So, if we look here, below your name and address, it says you will take one pill at 3 different times during the day for 10 days. Below that is the drug name, which is amoxicillin, an antibiotic. Above your name is the number the pharmacy uses to find any refills or information about your prescription. For some pharmacies, like CVS, they are trying to make their labels a little bit easier to read. They have some color-coded icons and pictures for when you take the medication, if it's at night or in the morning. They have bolded or larger print for some important information like the instructions, the drug name, and the dose, and a side panel of refill and important information for you to know. It still can be confusing, so when you pick up the prescription, make sure to check in with the pharmacist if you have any questions. So now let's get to the when. There are many different reminder devices that can help you know when to take your medications throughout the day. Do what feels best for you. Some examples are, if you have a smartphone or an iPad, you can download the app called CareZone that we talked about earlier. This will send notifications to your phone to tell you when to take your medicine. There's also timers and alarms you can set on your alarm clock, or you can use your Alexa device to set an alarm that happens every day. You can set it for whatever time you need to take your medicine at. So you can say, Alexa, set an alarm to take Advil every night at 7 p.m. There's also the good old-fashioned pill box. If you have trouble opening the pill containers, you can look into push-to-open pill containers that look like this. If you have any questions, reach out to Lisa. Another helpful way to help remember when to take your medications is creating routines around it. You can integrate these routines into, say, your morning or nighttime routine. So some examples may be, if you have to take medication 2 times a day, think of keeping it by your toothbrush. So when you go to brush your teeth in the morning and at night, you'll remember to take your medicine as well. If you need to take your medicine in the morning with food, think about keeping it by your coffee pot or in the fridge by your favorite breakfast item. That way, when you go to eat breakfast, you can take your medicine. If it's a medicine you're supposed to take before you fall asleep, think about keeping it by your nightstand or your book you read before you go to bed. That way, you can take your medicine right before you fall asleep. Look at what you do every day and when taking your medicine would work best for you. Now let's move on to knowing when to report any side effects. Certain medications and side effects may put you at a higher risk for falls. It's really important to keep track of how the medication is making you feel, especially if you recently started a new medication or changed anything about your medication. You can find the side effect information on your prescription bottle or on websites, but the best place is from your doctor or pharmacist. To highlight some really important warning signs, you're going to want to look out for if you ever feel dizzy, drowsy, if you feel like you have balance issues, or if you feel nauseous. If you have any questions about these side effects, talk to your doctor or pharmacist, and call 911 for any severe reactions like allergic reactions or trouble breathing. Let's move on to refilling your medication. Making sure you have enough of your maintenance medication is really important. Make sure it's refilled timely so that way your medication will stay on schedule. Side effects are more likely to happen when medications are stopped suddenly or started back up suddenly. One way to keep your medicine on track is asking your doctor if they can write the prescription for 3 months instead of 1 month, and then see if they can send it automatically through the mail instead of having to go pick it up at a pharmacy. This will help reduce the amount of times you need to go and ask for a refill. So, how does this relate to you? Well, have you ever taken medication without knowing why you're taking it? Have you ever missed a dose and felt off without that medication? So, what can you do now? Once again, you are the expert about your own body, so advocate for yourself to your medical team. Let them know if you feel a different medication or a different dose would be better for you. Let them know if you are feeling off due to any medications or if you just feel off in general. You are in charge of your own body. Learn about the medications you are prescribed by visiting the websites we talked about earlier, like drugs.com, or talking with your doctor or pharmacist, or family or loved one that helps you with your medications. Another way you can advocate for yourself is talking to all your doctors about all your medications. Sometimes doctors aren't the best teammates, and sometimes a cardiologist might have prescribed a medication where a primary care prescribed one that is similar, and taking those two together might not be great for you. So talk to all of your doctors, no matter if they prescribe that medicine or not. Also, you can look into apps, websites, or different pill boxes that can help organize your medication and make it easier. So let's set some goals. Everyone's different with what medications they're taking, when they're taking them, and how they're taking them. So their goals are all going to be different. If you never miss a dose and you have your medications built into your schedule and you take them like clockwork, then you may not benefit from changing anything about how you take your medications. But you may be interested in setting a goal to learn about what medications are doing for you, or advocating for yourself with your medical team. Whereas if you're a strong advocate and understand what your medication does for you, you might be interested in a goal about using an app, Alexa, or a different pill box to make taking your medications easier. These are only examples, so do what feels best for you. So, if we look at our handy reminder of water every day, wear supportive shoes, always take your medicine, take breaks, exercise, and remove clutter from pathways, the A is what we focused on today. Always take your medicine. This helps us prevent falls since we'll have less side effects. So to wrap it up, you can prevent falls by making medication easy to open and easy to take, creating a routine and a reminder on your phone or Alexa to take your medications, being aware of any side effects or how you're feeling while you're on medication, advocating for yourself when talking to your medical team, and learning about your medication by filling out the medication form. Thank you for watching, and I hope you have a wonderful day.